Hello and welcome to today's webinar, Dietary Supplements 101, the top 5 supplement mistakes and how to avoid them. I'm your host, Dr. Courtney Craig, CFS patient since 1998. You can find more about my CFS story over at drcourtneycraig.com. In today's webinar, I want to share some common misconceptions about supplements. These are things that I wish I knew years ago. Over the past 15 years or so, I've spent thousands of dollars on supplements, most of which had absolutely no effect on my symptoms. Part of that reason may be because of some of the points I'm going to talk about today. Another reason may be that when prescribed a supplement, few clinicians give detailed directions on how to take them. We will cover today how to choose supplements that actually work and have potent effects. We'll also uncover common things you may be doing every day which are making your supplements ineffective. Finally, we will find ways to streamline your supplement regimen to save you money and get you better results. I want to start by referring to a recent ebook that ProHealth released over on their website by Drs. Charles Lapp and Dr. Bruce Campbell. This book is free to download on the ProHealth site. Here, Drs. Lapp and Campbell state that to recommend a supplement for CFS, it must be 3 criteria. It must be safe, it must have scientific evidence to support its use, and it must cause a positive effect in at least 50% of those who take it. These are all valid supplement requirements, and I would support them myself. Throughout the webinar today, we will come back to this criteria, so keep this in mind as we look at our top 5 mistakes. Mistake number 1 is thinking that you don't need supplements if you eat a healthy diet. I hear this all the time in healthy people as well as in the CFS community. I wish it were true, but in today's world with soil depletion, pesticides, and the great unknown of genetically modified foods, there's no way to know for sure that diet alone meets our nutritional needs. Furthermore, in the complex puzzle of CFS, the demands of oxidative stress, immune system alterations, energy demands, supplementation is required to undo much of this vicious cycle. And lastly, since there's no FDA-approved drug for CFS yet, our best bet is to turn to smart, evidence-based supplementation to improve individual symptoms. And in fact, most CFS patients utilize some degree of supplements, either through their own research or under the supervision of a clinician. Yet when you look at the research, it's really sparse. What we do have echoes the need for supplementation. A handful of studies have shown consistent abnormalities in B vitamins. This paper in particular, from the Journal of the Royal Society of Medicine, looked at functional markers of vitamin B status compared to healthy controls and found that CFS patients tend to be deficient, particularly in the B vitamin peroxidine, which is commonly known as B6, and the vitamin thiamine, which is commonly known as B1. This fairly recent interventional study from the Medical Science Monitor I found most telling of the need for supplementation. They gave CFS patients a multivitamin, multimineral supplement for a period of 2 months. During that time, there was a significant reduction in fatigue, sleep disturbances, headache, flu-like symptoms, and autonomic symptoms such as orthostatic intolerance. The researchers concluded that a simple, inexpensive intervention like a multivitamin, multimineral may be a vital part of a CFS treatment protocol. Indeed, I would have to agree. A quality multivitamin should be the basic support foundation for all CFS patients. Mistake number 2 is thinking that all supplements are created equal. This couldn't be further from the truth. As some of you may already know, the FDA does not regulate the supplement industry. So what does this mean? This means that companies can release products without federal oversight or quality control. This also means that products do not require testing before release. When you buy a supplement, you should expect that what it says on the label is exactly what's in the product, but this may not always be the case. Whenever I purchase a supplement, I check the label for one of 3 things. I'm looking for a third-party regulatory label. Quality supplement companies will voluntarily request an audit from these third-party regulators to ensure that their facilities are adequate and that their products are pure and potent. The most basic status is GMP, or Good Manufacturing Practices, which is issued by the NSF, or the National Sanitary Foundation. Also, you might see USP on a label, which indicates that the product is of pharmaceutical grade. When choosing a supplement, I want to see at least one, if not all of these, third-party regulatory statuses to ensure that my product is the best quality. Some, but not all, over-the-counter supplement companies meet these standards. In my experience, store-bought vitamins have questionable potency, and there is no way to know how long they've been sitting on the shelf or how long they sat in some warehouse somewhere. Another important point I'd like to make is that many supplements are loaded with fillers and additives which aid in the shelf life and improve things like the color, the taste, or the structure of the final product. Common fillers include cornstarch, wheat gluten, or sugars and dyes may be added as well. When I look at a label, I also look for signs that the product does not contain these fillers, things like gluten or anything unnecessary. This issue may be especially important to those with comorbid celiac disease, non-celiac gluten sensitivity, or those that have an allergy to nuts or shellfish if the ingredients in the product were derived using these potential allergens. When in doubt, contact the company directly to ask about additives. Mistake number 3 is thinking that a vitamin is a vitamin is a vitamin. Bear with me as we take a quick look at a bit of biochemistry to understand this fallacy. Vitamins come in many forms. You may be taking the correct vitamin but using the wrong form. For example, B12 is commonly given either sublingually or by injection to CFS patients. But look, we have 4 different forms. Methylcobalamin is a component of the methylation cycle. Cyanocobalamin is the most common form because it's inexpensive, but when it's broken down in the body, it creates cobalamin and cyanide. Yes, you heard that right. Cyanide. Hydroxycobalamin is believed to be useful for brain health. And finally, adenosylcobalamin is the least common of the 4, but may play an important role as a scavenger for the molecule hydrogen disulfide. Hydrogen disulfide is a byproduct of intestinal overgrowth in the small intestine. This is very common in conditions of dysbiosis or leaky gut. Another example is CoQ10. This potent antioxidant is necessary for the production of energy in the form of ATP. CoQ10 comes as either ubiquinone or ubiquinol. Ubiquinone is the oxidized form, meaning that the body has to convert it back to its active unoxidized form. Ubiquinol, on the other hand, is biologically active as is, thus utilized better by the body and even better absorbed. Lastly, I want to mention folate, which is also frequently supplemented in different forms. Let's look at the folate cycle to get a better understanding of how important getting the right form of a nutrient really is. Folic acid, whether it's in a vitamin or the folic acid added to enriched grain products, has to be converted to DHF, then to THF, then to 5-methyl-THF, before it's considered biologically active and can participate in chemical reactions. There are 3 enzymes, DHFR, 1 and 2, and MTHFR, that have to work efficiently to convert folic acid into this usable form. In a perfect world and in a healthy individual, this may occur. But in reality, a large percentage of the population has genetic alterations in these enzymes, which causes this conversion to be slow and inefficient. Now here's where Dr. Lapp's safety issue really comes into play. Research has shown that if folic acid is not efficiently converted to its active forms, it may cause a buildup, resulting in unmetabolized folic acid, or UMFA. Elevated UMFA has been implicated in the development of some cancers. So when in doubt, choose active forms of vitamins to bypass potential roadblocks in your biochemistry. Mistake number 4 is thinking that how and when you take a supplement doesn't matter. Anytime you take a supplement of any kind, you should always consider the issue of bioavailability. Well, what's bioavailability? Bioavailability can be defined as how likely that nutrient you take is going to be taken up by the body and put to use. There are many factors that can affect bioavailability. Let's take a look at some of the most common factors. First, should you take a supplement on an empty stomach or a full stomach? This could be very important for nutrients that are fragile and may be essentially digested instead of absorbed. For example, probiotics should always be taken on an empty stomach to avoid the digestive process. Another example is N-acetylcysteine. NAC, which is commonly given in CFS because it's a precursor to glutathione. This is not a cheap supplement, so you want to make sure you take it right. NAC is fragile and easily broken down by digestive enzymes, so it should always be taken on an empty stomach. Secondly, you need to consider what kind of foods you take supplements with. Certain foods, especially grain products, contain molecules called phytates or phytic acid. Phytates act like a magnet. They bind minerals, making them no longer available for absorption. So for instance, if you take a magnesium supplement with a meal that contains a high amount of phytates, the phytates in that food will bind so tightly to the magnesium that it has no chance of being absorbed and utilized by the body. Talk about a waste of money, right? For this reason, I always recommend mineral supplements be taken on an empty stomach to ensure absorption. A similar thing to consider is taking supplements with coffee or tea. Coffee and tea contain tannins, which are similar to phytates in that they bind readily with minerals, making them less bioavailable. Also, coffee and tea have other properties that hinder absorption of nutrients. An example of this is the supplement creatine. Now, creatine is sometimes given to improve muscle pains and fibromyalgia. It's also very beneficial for the health of mitochondria. Creatine is normally well absorbed, but in the presence of coffee, completely blocked and unusable. I should also mention that supplements shouldn't be taken with certain medications. The classic example here, again, is probiotics. They should never be taken near the same time as an antibiotic. You'll be destroying the bacteria that you're trying to fight with the antibiotic, as well as all those beneficial species that you're trying to replenish with the probiotic. If you are taking an antibiotic, it's best to spread out the timing of dosages. You could take the antibiotic in the evening and then the probiotic first thing in the morning, for example. That way you minimize the opposing effects. There are numerous factors that affect bioavailability of a nutrient, but I'll close this topic by saying that supplement companies are now developing better and better absorbable forms, such as vitamin D, which is poorly absorbed as a tablet, but readily taken up when it's emulsified in an oil and given as a droplet. There are many other examples, but just being aware of this notion of bioavailability is vital when taking supplements. That way you get the most bang for your buck and the greatest effects. Our last mistake, number 5, is the belief that you should take a single nutrient at a time to see if it is beneficial on its own. This is a valid assumption, and one mistake I often made years ago. I would start taking vitamin XYZ for a month to see if it had any effect on my symptoms, and if it didn't, I'd stop it and try another vitamin XYZ. This is logical, but problematic for a couple reasons. First and foremost, this line of thinking can lead to an overflow of your supplement drawer. My pill case used to look something like this. At one point, I was taking 30 to 40 pills per day, but have since been able to streamline that down by at least half, if not more. Taking single nutrients adds on cost very quickly, and it might not be effective. Instead, opt for nutrients found in formulations, which provide a synergistic benefit. Given how complex and multifactorial CFS is, it's almost naive to think that taking a megadose of a single nutrient will have a dramatic effect on the entire system. It could be a drop in the bucket compared to the overall metabolic picture. Instead, I've found formulations to be far more potent and effective on symptoms due to this synergistic effect. For example, this immune supplement from Designs for Health offers over 10 ingredients in a single capsule, minimizing the need for excessive pill taking. You may have heard or read somewhere that certain types of mushrooms are beneficial for immune function, particularly in raising natural killer cells, so you go and buy a mushroom supplement. Then you read that astragalus root is beneficial for boosting the immune system too, so you buy a bottle of that. Then you hear that green tea is a potent antioxidant and you buy a bottle of that. You now have 3 different supplements that sit on your counter when you could have just bought a formula that contains all 3 and then some, which saves you a lot of money and is likely more helpful than single nutrients due to this synergistic effect. Yet another example is an adrenal support supplement. These are commonly utilized in CFS patients. Now, just taking tyrosine or B6 alone may be less likely to benefit your symptoms than taking a product like this that contains all of the essential nutrients that the adrenal gland needs to function optimally. There are numerous examples of formulas, all of which are available on the online dispensary on my website for various needs. I've used all of them, and I know that they are effective, and they are certainly more economical choices than buying single nutrients. So to summarize, I can't emphasize enough how important it is to buy a quality supplement that is pure, potent, and from a trusted company. The online dispensary found on the website is personally curated to include my favorite companies that I use myself or that I know personally. These companies all utilize nutrients that have research behind them, and many of the companies even conduct their own clinical trials. Remember, this is Dr. Lapp's number 2 criteria for supplement recommendations. A supplement must be evidence-based. We also covered how important it is to be aware of bioavailability and to take supplements strategically so we know they will be taken up and used by the body. We noted how some supplements in inactive forms may be poorly absorbed or even dangerous. When in doubt, always take active forms of vitamins. And lastly, we found ways to save money by opting for formulas instead of individual nutrients that may not work as well on their own. I want to thank you for viewing this webinar and stay tuned for future webinars. Now that you know, where can you go? You can find more information at drcourtneycraig.com, including access to the online dispensary where you will find quality supplements that meet the strict criteria that we discussed in today's webinar. Also, questions or comments can be submitted through the website. Until next time, best in health.